if you look at healthcare spending in general everywhere, it's going up and up and up.
As we all know, that it's just continuing to rise and go up. We have been able to manage our increase in our health insurance premiums because we think the clinic has played a big role in that by being able to keep our staff in a healthy setting, being more proactive rather than reactive. And our health insurance premium increases in comparison to a lot of other places around in Northwest Ohio have been very small, and compared to that, a lot of districts you're seeing go in double digits.
Our biggest rate increase in 5 years has been 5%. Typically been 3 to 4% rate increases. So our costs are going up, but at a much slower rate than the national average. The national average is at least double of what we've seen.
I attribute a lot of that to the clinic because of that proactive piece of helping to manage wellness before things do get worse or people having, whether that's high cholesterol, blood pressure, all of those things that contribute to health problems. If we can proactively take care of those things and address them before they get bad and go to the high expense items, I think it ultimately saves our plan, and then also reduces our premium for our increases for our employees as well.
With the position I'm in, I look at involved with the health insurance renewals every year, but I've also discovered too, just from my own personal self, my personal health care, that when I take care of do the preventative care, that I'm not going to the doctor as much as I need to because of ailments. You know, I'm going to follow up on blood work. I'm not going because I, am sick and have a cold or something like that. Just, making those healthy changes and just making sure, things are where they should be before something goes wrong is huge.
And I think over the last 5 years, our utilization by our members is grown significantly, and played a role in that, encouraging our employees to use the clinic. It's the most cost-effective option we have as a district, and plus they get outstanding care by doing so.
So WeCare TLC, having the clinic available to us, it's a benefit to the employers, because if you have a healthier workforce, you're going to have, employees that are taking less time off to be sick. You're going to have less downtime, and you should have a more productive workforce because they're healthy.
If the clinic were to ever leave or close, I think we would see an increase of people going to urgent care facilities, people going to emergency rooms, people even going to their primary care doctors. And I think we would see a rise in our overall expense. I don't ever see it really being one of those things that we would put on the chopping block, so to speak. Everything always is, but we'd have to be in pretty dire straits to be able to stop that relationship. We knew that the benefit outweighed the expense of that, and we have continued that relationship.